Whether you're looking for answers to specific life questions or seeking to become the best version of you possible, welcome to the Mental Breakdown and Psychreg podcast, where we offer insight, information, and strategies based upon research and years of practice as clinical psychologists. So sit back, have a listen, and get connected with our hosts, Dr. Berney Wilkinson and Dr. Richard Marshall. Welcome back. Richard, today we're going to talk about subclinical symptoms.
Explain why that's important, because it really, really is.
Yeah.
But we don't talk enough about this.
Right. We hear statistics sometimes that say this massive percentage of people are going to be depressed at some point in their life. Or we hear that massive percentage of people are going to be anxious or suffer from distractibility or have these. And we think, wow, that's a lot of people with these diagnoses.
Right.
And those are two different things.
Right.
Subclinical diagnoses, subclinical symptoms, I should say, are the phenomenon that we all experience. You know, if we lose somebody in the family, if something stressful is happening, if we find ourselves somewhat, having some difficulty focusing and concentrating. Right. Because we have those symptoms does not necessarily mean that we have a disorder.
Or a diagnosis.
Right.
When we make and we say this all the time, that ADHD is a clinical diagnosis. Right. Depression, schizophrenia. These are clinical diagnoses, which means we don't have a lab test for this. We can't test your insulin. We can't test your blood count. We can't give an X-ray. We can't do an MRI. We don't have any lab test. We use clinical symptoms.
Right.
And if you have enough clinical symptoms, you get a diagnosis.
Right.
But you're absolutely right. Many of us have subclinical symptoms. We have symptoms, but we don't have enough, or they're not as severe.
Right.
But we still have the symptoms.
Right. Right now, and we mentioned this on the podcast from yesterday, we are recording these podcasts the day before Hurricane Irma is supposed to hit Florida. I'm mentioning it again because I know that...
No, you know what's... It was that picture of Andrew and Irma.
That's what did it for you?
Mm-hmm.
Yeah.
Because I know my dad was a contractor.
Right.
And he worked for he worked with insurance companies. And all of the adjusters that he worked for went to South Florida because that hurricane decimated South Florida, Miami and Homestead. And the adjusters lived there for months. And I know how devastating Andrew was. Andrew is a tenth the size of Irma.
Yeah.
And so seeing the size of this thing and the amount of damage it's going to do if the winds sustain is a very big concern. I mean, this could be, it's just unimaginable. We don't have anything. I wrote to my brother who lives in Germany, quietly lives in Germany, and I said to him, we don't know what's going to happen because nobody's ever dealt with this before. Yeah. And that sort of uncertainty and potential danger, because we have children and people to take care of, that sort of potential danger produces anxiety.
Absolutely.
So we are becoming, some of us are becoming increasingly more anxious.
That's right.
But you become increasingly more anxious as this storm approaches. Our anxiety will increase.
Right, and we see people behaving in atypical ways. We see,
that's right.
We've heard reports of people fighting over cases of water.
A man got arrested for hitting somebody in a store.
So we see these things happening. We see these experiences going on in the world, and we see these significant increases in symptoms of anxiety and depression and stress and all of these things during these kinds of episodes. But it doesn't mean that they're diagnosable. It doesn't, because somebody is anxious about what's going on right now, doesn't mean that they have post-traumatic stress disorder, that they have, disorders that we could make up like, inclement weather anxiety disorder or something like that.
Social media anxiety disorder.
Right. It doesn't mean that they have that. It just means that they are under duress at this moment in time because of environmental situations.
My mother is 94, lives in a high-rise facility, and she is absolutely beside herself with fear. She's not only because she has no control over her circumstances, okay? And she's worried about all of us. So she has her worry and everybody else's worry. Does she have a diagnosis?
Right.
No.
Right.
She's very, very anxious. She may slip into a low-level depression at some point, but even she has subclinical symptoms.
Right.
These are she's feeling a little anxious, she's feeling a little depressed, she's a little down, but she doesn't have a diagnosis.
Right. I use the example in when I'm teaching this. I use the example of ADHD. We think
True.
of people who have who are distractible and who have hard time focusing and concentrating and staying on task in class as having ADHD. And so what I do oftentimes when I'm teaching this is I will pull out a passage from a molecular genetics book,
Right.
and I'll start reading from that book, and you can see people's eyes starting to glaze over and they're starting to shuffle around,
Right.
and I'll say, okay, so I just elicited inattention from you. I just elicited off-task behavior from you. Does that mean that you have ADHD?
Right.
And it doesn't, obviously.
Right.
It doesn't mean you have ADHD. It's clinical symptoms, but they're subclinical, meaning that it's not sufficient for a diagnosis.
That's right.
It doesn't mean that there's a mental illness or mental health concern, a major mental health concern going on. It just means that you have some symptoms.
Since 1995, we've struggled with this with early onset bipolar
Right.
disorder. Every time a child has a temper tantrum, bipolar disorder.
Right.
No, and it's not bipolar disorder.
Right.
Okay, it's not disruptive mood dysregulation disorder. Those are clinical conditions, very serious, long-standing, and intense symptoms.
Right.
Just because you have a temper tantrum, even if you're 8 or 9 years old, it doesn't mean that you have bipolar disorder.
Right. Exactly.
Yeah.
So it's really important that we talk about this. And this was a column or article written in Psychology Today by Dr. Marty Nimko. But also we're going to talk a little bit about there's this other article written in Psychology Today by Dr. Diane Stoller. About how some stress is good for you. And so we think about stress and anxiety and all of these things as being a problem.
Right.
But a lot of times these subclinical symptoms really serve us an important function.
Right. They motivate us. They goad us into doing something. Right.
Right, right. And so, I think that something that Dr. Nimko presents in his paper, or his column, is some ideas or perspectives to consider when you're looking at these or experiencing some of these symptoms. Certainly an underlying theme is let's figure out why it's happening.
Right.
If you're stressed, if you're sad, let's look at your circumstances to see why this may be happening.
Right. And what you can do about it.
Right.
Okay, so if for subclinical sadness, okay, you don't need medication.
Right.
That's the first thing. You don't need to rush to medication, but you may want to make some changes. Give yourself something to look forward to.
Right.
Sometimes our weeks become very long here. We're teaching and we're writing and we're seeing patients and coaching and doing all kinds of things. And sometimes if I plan something fun on a Friday evening, it sort of gets me through the whole week.
Right.
No matter how tired I am, I look forward to that and I feel better about everything. Especially if I make plans with my kids. If we plan to go out somewhere, plan to do something, I'm thinking, wow, this is really a long week, but all of a sudden you perk up. So give yourself something to look forward to.
Right.
Okay.
Exercise. That's another thing.
Wow.
And
so important.
Not just for sadness, but for some of the other issues as well. When you exercise, it improves your mood and takes away sadness.
Right. And what's that third one?
Perspective.
I love the way
you do have to, you have to consider your perspective, especially when you're talking about mood.
Yeah, and you hate to be morbid about it, but boy, there are people who really have much more serious problems than we do. I mean, man, it really can be a lot worse. So count your blessings.
Yeah. And as we go through some of these different ones, like for subclinical worry and for subclinical anger and inattention and distractibility and all these things, he really does a nice job of capturing some of the things that we experience at those times. Why, when you're worried, sometimes it's good to think about, okay, what is the worst case scenario? What is the worst thing that could happen?
That's right.
And then is that going to destroy you completely?
Right.
Okay, no. that would be the worst case scenario, but this is what I would do in response to that. Well, that in and of itself is going to relieve some worry.
That's right.
Well, we try to block and fight those thoughts and everything.
Right.
And instead of just like problem solving through it, now sometimes you want to suppress, and suppress is actually one of the things he mentions as well.
Right.
Sometimes we want to suppress some of those worries and some of those thoughts and stuff, but that's not the only strategy we have to use.
And I tell myself, because we all have this, sometimes you can suppress it, and that's the best thing to do. Just say, look, stop worrying about it. There's nothing you can do about it. Stop worrying about it. There are other times where you can't stop worrying about it, and we advise patients, go ahead and worry about it.
Right.
Get it out of your system. Worry as much as you want. Don't let it ruin your life.
Yeah.
But stop fighting these little, I call them niggling worries, these inconsequential, really, in the big picture, they're inconsequential worries. Go ahead and worry about it. Just let your mind roam. Say, I'm going to take 5 or 10 minutes and I'm going to worry myself to death for a few more minutes. And then when I'm done, then I'm going to go back and do what I need to do.
Right.
I'm going to go back and live my life.
And recognize that the worries sometimes are just trying to tell you something.
Right.
Sometimes those worries are just there to say, hey, you need to think about this from a different perspective.
Right.
And so when you do that, when you allow yourself the opportunity to do that,
whether it's worry, distractibility, stress, no matter what is creeping into your life, they can all be turned into positives.
Right.
Something in your world is telling you that something is a little bit out of focus.
Right.
So get it back in focus. Do what you need to do to get it back into focus.
Right.
Just worrying
Yeah.
isn't going to get it back into focus. It's okay to worry, but when you're finished worrying, then go do something.
Right. He mentions a few really nice things as it relates to subclinical anger. There's that cough again.
Yeah.
He talks about, of course, escaping the situation, exiting, getting out of it. Talks about avoiding triggers that causes anger, and of course self-therapy.
Yeah.
Think about how you're thinking about the world.
Right.
Sometimes we just hold on to resentment, but for what?
Well, and especially, we talked last week when we were talking about men's mental health, and we talked about how many men, and it was right after Charlottesville, and we talked about how many men view the world as a zero-sum game.
Right.
There are only so many jobs. There's only so many positions. And if somebody else has one, a woman, for example, then they're taking my job.
Right.
This week we saw it with DACA, and because it was presented as, well, if we have these immigrants here, regardless of how they got here, if we have these immigrants here, they're taking our jobs. That's not true. Okay?
Right.
That's the fact. I mean, if you look at the economic data, they're not taking anybody's job. They're productive citizens paying taxes and doing what other Americans are doing. So it's a deception to say they're taking our jobs. But many people have that worldview, that it's a zero-sum game. Okay?
Right.
So if you tend to look at the world that way, you tend to be angry. And anger has a way of coming out, as it did in Charlottesville or Berkeley or any other. Doesn't matter what your political affiliation is, whether it's left, right, or center. Anger has a way of expressing itself in some pretty ugly ways.
Yeah.
So.
And then the last area that he talks about is distractibility. And clearly, if you're struggling with subclinical distractibility, you need to get rid of the distractions. You need to, accept yourself for who you are. Sometimes it's really difficult to focus and concentrate while you're reading. Well, so you can either accept that and do what you can, or you need to shift and adjust to something different.
I can't sustain my effort over hours.
Right.
I learned over time that I need to take frequent breaks, or I need to set up my day so that I can work very intensively for a short period of time and then take a break.
Yeah. You just have to know yourself.
Right. I mean,
yeah.
I'd probably benefit from a little stimulant here and there, but
which is his third one for distractibility. It's medication, maybe. Maybe you need it, but it's not for everyone. It's not something that is necessary for everyone.
Not everybody.
Not even most. So it's a really cool, interesting article. He has a lot of great ideas here, and we definitely encourage you to check it out. The link will be in the show notes. And it will give you some ideas about how to handle some of these subclinical symptoms.
And I encourage you to read this because this most of us, we say probably 20% of us meet criteria.
Right.
Okay, that means most of us don't.
Right.
Most of us, however, are at one time or another will experience these symptoms.
Right.
So this is meant for the other 80%.
Right.
Okay, it's also meant for anybody with a partner, anybody with children, anybody
Yeah.
with grandparents, anybody taking care of your parents. You're usually dealing not with a diagnosis. You're usually dealing. Chances are you're dealing with a subclinical set of symptoms,
Right,
which
right.
require a different approach.
Right. So, all right. Well, check it out. We'd love to hear
Yeah.
from you, hear what you think about it. So, all right. Until next time, stay happy, stay healthy, and forget to be afraid. And hopefully our coughs will be gone next time.
I don't know what that's about.